Hello, friends, and good evening to all of you. Wishing all the men viewers a very happy International Men's Day. And today on Banyan Minds, we are with again a very interesting topic, and that too with such a nice expert with us, a doctor with us. And I will start this session by saying, men will be men, but I'm saying this in a very positive note. This is a advertisement tagline which you must have heard n number of times. It's been running for so many years. But on a positive note, yes, men will be men, and why not? A very nice thing which I always keep hearing in the video is that one of the celebrity, who has she has represented us on global platforms, and she has said that when the Creator has created us differently, the man and the male and the female, then why this struggle for proving the equality and who is superior and who is not superior? So if you really want to understand that, it's quite in depth to understand that men and women equality. When we talk about, it's not at all necessary that you have to compete with each other, proving that he can do his roles in a better way and she is the superior most person. So no, it doesn't work that way. Actually, we all know our responsibilities as a male, as a female. We understand. Yes, there are darker side of the stories, and they have been always highlighted. Our culture says that a man or a male is always shown in that macho image, and he's the one who cannot be emotional. But I don't think so. This is right. Every male has the right to express himself emotionally. Yes, he is looked upon as a strong person. He is looked upon that macho person. He is looked upon a person who can take n number of responsibilities. But in the today's changing context, female are also doing equally the same things. But let us understand one small thing over here. The society glorifies a lot of things which are related to female, be it their health and be it their physical health, be it their emotional health. So being a female, I am saying this because I see a lot of awareness drives happening around female health issues and female mental health issues, female laws and female legalities. But then where does the man in the society go? I mean, because of few men who are spoiling the scenario in the society due to some bad acts, okay, which are quite impactful on the society, no doubts. But what happens is, because of those small set of men or those set of men, the other men really suffer. So today we are going to have a very nice talk with a psychiatrist, and she has really spared some time for us out of her busy schedule. She's a very senior psychiatrist, and she is going to tell us that how mental health of a man is important, how it has to be monitored right from the childhood, so that when this particular man reaches the post, or I will say, yeah, I call it a post. I mean, being a senior citizen is like a post, and I think so that's the highest post or upgrading which happens. It is also because things are changing in modern life. But Banyan Minds has taken this concept from a very different angle. And this angle is of those four compartments which used to be there in the olden days. And our scriptures, our Indian scriptures have said this in such a beautiful way. See, stress, problems, these were there even in the earlier olden times, and they are there today even in the modern times. But the intensity they have reached today, and because of which because of very small problems, we are losing people today. We are losing human beings today. A small emotional problem is exaggerated in such a way, or is blown up in such a way that a person cannot handle stress, especially a man. And the effect of this is too bad. So all these things, all these observations, I thought that I would share, and I would put it across to you guys, so that all the men who are watching this interviews, it will be helpful at some point of time in their life. So please listen to the experts. I mean, they come from a big professional experience also. They have tackled so many people also. So just now, what I'm going to tell you is just an introduction of what the interview is going. Interview, more than interview, it is a talk which is coming from the doctor, and she is going to tell you that how these 4 stages of life. Okay, so which are these 4 stages? The brahmacharya stage, the grihastha ashram stage, the vanaprasthashram stage, and the sannyasi stage. So brahmacharya stage is nothing, where the child, when he is born, okay, especially a son, when he is born, he's taken good care of, he's given a lot of love and care. But at the same time, when it is time to discipline him, to educate him, he's sent to a ashram, okay, where he's only with the teachers and the other fellow students. So his focus is completely on study, career, everything. The second stage, which is your grihasthashram, as the name suggests, is about coming back to house, getting married, having children, and growing the family, taking more responsibilities. Then is the stage of vanaprasthashram, which is nothing but a slow detachment stage, where you start detaching from the family very slowly. It is not something which happens on a spur of a moment. It is a very small process and happening in a very slow speed. So this is the time when he starts detaching from the family, because the children are growing now, they have been taking some responsibilities. The wife has reached to that maturity stage in that house, in the in-laws house, where she is ready to take up responsibilities. So this man now has to move out of the house. So he goes towards spirituality. He starts imparting his knowledge to other students. So that's how the progress happens. And then the last stage is complete detachment. So it's, in today's time, I would say it's called the me time, a complete me time which this man has. So whether his spouse exists or his spouse doesn't exist, he goes and stays completely away from the house, completely detached. So I welcome on board Dr. Prajakta Gupte. Good evening to you, ma'am, and thank you so much for removing this small time for us, and explaining this so much in details. And I understand that the emotional health of man is such a different topic, and when it comes to the Indian context, it's totally different. So I'm sure that whatever you say, people will listen to it, people will try to understand it. So I welcome you, and I'll be introducing Prajakta ma'am. She is being trained from very reputed hospitals in Mumbai, like the KM Hospital, which is in Parel, and the Nair Hospital, which is in Bombay Central. She is a fellow. She has her fellowship from Royal College of Psychiatrists, UK. Okay, so ma'am has done her studies from the UK, and she has been practicing psychiatry from last 17 years. She's attached to very renowned hospitals in Thane, Maharashtra, and the hospitals are Jupiter, Bethany, and she's an extremely humble human being, I must say, to all the viewers, because she immediately agreed to explain this in the way Banyan minds wanted, and you can make it out from the way she has done this small insightful observations to come to certain conclusions. So welcome, Prajakta ma'am.
Good evening, everyone. On this occasion of International Men's Day, I wish all the men a very happy day. And so today we have chosen a topic which is to look after men's mental health. So it starts not only when a man is in his adulthood, but right from the beginning. So this idea has stemmed from our scriptures, where our life is divided into 4 stages, where it's brahmacharya, when a young boy is educating, training, getting all his skills; grihasthashram, which is where he leads a married life, is earning, supporting his family; vanaprastha ashram, where he is getting the next generation ready and handing over, slowly detaching himself from the routine life; and lastly sannyas ashram, where he actually physically leaves the family and goes and stays in the forest. That was what the scriptures had talked about. But if you compare those 4 stages to the current life, it is not as well demarcated. So there is an overlap. Our longevity has increased, so we live for a longer time. So these stages, the older age, maybe after 60 or 65, is a big span of maybe around 20 to 25 years. So then comes a point of how can you retire so early, and how can you give up so early, and what do you do for such a long time? So let us go right from the beginning, when he's a young boy, and what kind of pointers help in good mental health in future for him. So if you look at young boys, so say from 6 to 11 or 5 to 11, what are the issues that they face? So they're school going boys, so academics, so maybe somebody is struggling with academics or trying to get to settle in the school, making friends, getting accepted by peers, so he has to have a set of friends. All of them are not lucky enough to have, some may be struggling. Bullying, some people face bullying in school, so ones who are very anxious, very meek, fearful of crowds, they may face bullying. And there are also some who are very boisterous, very hyperactive, or very interested in sports and other physical games. So all of them, how do we keep up the good mental health in these boys? So one is regular, what we do for children, which is common for boys and girls, and that is healthy food, which is very important. So we talk in context of today's availability, and that is where there is a lot of junk food options. There are now, it has post-COVID, it has been made easier with where you can order online, where there is huge access, where children can order online on their own. All of us have become independent with the online option. So healthy food is of prime importance, where you can limit eating outside food or junk food, say 1 meal in a week or 1 meal in a 15 days. So what is important is you demarcate and set limits. Limit setting at this age is very important in order to inculcate good habits, and this is where these limits then work into teenage. If you do not set limits at this age, then it is very difficult for teenage boys to or girls to listen to new rules that come in the way. So good food, some physical activity. They have to, it's important that they pursue some sports, physical activity, because sports is a very natural way of teaching team play, to be able to wait for your turn, to be able to support your teammate, that you may lose and you go back and you start new again. It teaches you hard work, that you have to work hard towards your goal, and nothing comes easy. So just following a sport teaches, and if it's a group sport, then it teaches a lot of things which are daily life skills, which are important for him as an adult. What sports does is gives you confidence of I can do it. There is an aim and I need to follow it, and if I do this, then I will achieve it. That kind of simple rule is taught very naturally to children. Enough sleep is one point. Now with internet access, late movies, OTT platforms available, children post-COVID children have got access to internet, so there is not enough sleep. Sleep is the first thing that goes is decompensated or goes for a toss, especially on weekends or late nights. So why is sleep important? For good concentration, good focus, a better mood. When the child has not slept well, he is not able to focus, he is sleepy in school, he is irritable, he can get into fights more easily, he is prone for errors. So good sleep is vital. Very, very vital is good home environment. So the home environment or the relationships at home are extremely important for a good childhood and a healthy adulthood, because this is where he's seeing what used to happen earlier. They would go to a teacher, say brahmachari, they would go to a teacher, live there, live with the teacher. He would teach, he would get the impart training, he would give all the skills. So they were away from home, but now home is the teaching ground. So relationships, how parents deal with each other, how parents talk to each other, how parents talk to the children, how parents and grandparents interact, how parents keep their social relationships, extremely important, because it's very simple. What happens at home will be reflected outside. If there is abuse at home, if there is violence at home, it is going to be reflected in his behavior. He could be more aggressive, he will have less patience, he will not wait for his turn, he may not be able to share things in school. So good home environment is extremely important. What do we need to teach children at this age? You need to teach your boy to be able to express. So if I am angry, rather than throwing a tantrum or being angry or going away or sitting down in the mall, I have to be, that boy has to be able to tell, I am upset, I am hungry, I did not like coming here, or this is what I did not like, or I am scared, this is what happens at school. To be able to express. And when will that happen? When there is somebody at the other end listening. So for your child to be able to talk, you have to be able to listen. So giving that time in our daily life, and all of us are struggling towards making a better future for our children, but giving that time, that is priority. Leaving that work aside and giving. So it need not be hours. It could be 15 minutes when you and he are on one-to-one, just listening to what has happened, and you will get so much information. What happened, who did he have a fight with, who did he share tiffin with, what did other children get for tiffin, what did teachers shout at other people, what is to be done tomorrow. It also jogs their memory, the ability to express, ability to remember and get back. So all these things, their responsibilities, what happened in school. So you get a lot of information just being a patient listener. Connecting. So at this age, what is also very important, like I said, home environment, but to be able to connect with others. So going down to play will help making friends, also teaching him the importance that friends stay. So small fights, you need not break your friendships. Friendships will prevail. So try and resolving your differences, try and apologize, make friends again. These are skills that we need to teach our children. uh, them attending community meetings, like attending festivals, attending pujas, attending birthday parties, attending family get-togethers, family gatherings. These are values that we are inculcating, where they understand that social component is extremely important for a healthy for healthy living. Just me, myself, my work, my job, that will not work. You have to be able to connect. My parents would do that, now I will do it, because then that trend is set. Some amount of charity, to be able to share, to be able to give, if you have in surplus, to be able to share, that needs to inculcate from a very young age. I think these values, if they are practiced very regularly at home, and not with an intent to teach the child, but if it is generally practiced at home, I think children take it in.
So what ma'am has told in this session is all about longevity. I mean, this is a little nice thing to know, that because of lot of vaccinations, good medications today available, the lifespan is increasing, especially as ma'am said, in case of male members, it is definitely a good lifespan they are having. But nevertheless, because of this long lifespan, the life needs to be planned. And as she very rightly mentioned one word which I liked a lot, limit settings. So as we all are so adaptable to do settings, on our laptops, on our television, similarly these are settings in the life which she is talking about, and this has to be done right from the childhood. That is what she mentions over here. Is about seeing your television, having food on time. So these are all the limits which have to be set from the childhood, because these are the habits which will then further impact your future life. So that is one good thing. The second thing which she said was social participation. So parents have to inculcate this social participation in children. So along with the birthday parties, these can be cultural social participations, like going to someone's marriage, going to pujas, going and celebrating festivals together. Because like she rightly said, apart from all the parties and everything which you have, all these kind of social gatherings also create that kind of values in your child. And also she said that in this stage, the child wants to express, there is a lot to say. So you have to be a very good listener in this stage of life. And because listening will solve half your problems.
Okay, so if we come to when the boy grows a little older, say he's a teenage boy now, what are the issues that they face? It's a very, very crucial stage, very important. So if you look at how it was in earlier stages, it was easier, because brahmacharya, he is at his teacher's ashram, and there are no internet, there are no distractions, there is no substance abuse. So I think it was easier. But now children have a lot more choices, a lot more distractions, and it is that same stage where he is not a child, but he is not an adult. So the equation of rights and duties is a bit confused. They want all the rights, they are not big enough to take the duties. So there is a fight for to take on more rights, and there can be a conflict if not dealt with well with parents. So there can be a conflict between parents and teenagers. Sometimes it's very mild or minimal and it settles. Sometimes it can go on for a longer time, and or it may culminate or end up in aggressive episodes or temper tantrums or incidents which need intervention from mental health professionals, which can happen. What is important is both parties cannot be angry at the same time. So if one party is upset, then the other party or the parents have to keep the negotiating skills open all the time. So what are the issues youngsters face at this point? So it is internet, smoking, alcohol, access to pornography, gaming, now with so many games. So COVID pandemic has taught us that internet access has been fully explored by this generation, this group of children. Some who are, so there is a range. Some people are quieter, they will follow the rules. Others want to explore their options, want to try out new things, so they will probably explore smoking, alcohol, drugs use, access to pornography, or going to gaming, or people coming overnight online and playing games which could be aggressive. So what is important is, like I said in the previous stage, limit setting is very important. And limit setting will not happen at this stage. Limit setting has to start from a child when he's 6 to 7 years old. So there has to be a rule as to how much is the internet access, what is the time. Now if you tell a 12 or a 13-year-old or a 14-year-old that till now you were watching 2-3 hours, but from today it is going to be half an hour, then it is going to be difficult. So it cannot come at this stage. It has to be a little earlier. And so limit setting is very important, and for that following some limits ourselves is very important. So if you tell him you stop the internet, you stop accessing internet, but you are seen watching a film late in the night, then there is going to be clash. So that is one point. Encouraging them to share their feelings. So whatever it is needs to come on the table, needs to be communicated with. So whatever issues that door has to be open, or that option has to be open, that I can come home and talk. Even if I am wrong, I can come home and talk about it. So maybe I have so they get into relationships at this age. It starts from 8th standard or so, where they start talking about this, the awareness, there are hormonal changes, there is increase in testosterone, so a lot of bodily changes also. One, explaining these bodily changes to them, what is happening. School does part of it, but I think as parents we need to explain what is to be expected, what is happening to you, so that he doesn't explore options to answer these questions. He gets questions in his mind: why is this happening, why is that happening, and then they explore, because now if you search on Google, you will get answers for everything. So rather than him stumbling upon some information, I think when he's around 10 or 11 years old, I think this kind of sex education has to be imparted. Somebody has to talk to him about it, as maybe the father. Emotionally getting him to share his feelings. So he could be angry, he could be upset, he could be anxious, he could be scared. To be able to tell and find out the reason for it. Why am I feeling? So it's just not important that I am angry and then that's why I am breaking things, throwing things, I don't want to study. It is important to know why you are angry. And the anger has to be directed towards that thing, not generally. So which we call in psychiatric terms displacement. Anger is at a thing, but anger is exploded to other people or on things, which is not a good coping mechanism. What we are teaching them is everything will not go according to how you want it. Maybe in academics, maybe in relationships, in friendships, but we need to keep negotiating. People may be upset with you, you may be upset with people. One is talking about it, talking to the person, apologizing if required, but keeping that interaction on rather than breaking, directing that anger towards somebody else. Third is giving responsibilities. It should not be that parents are slogging and children till the age of 18, 19 are sitting, once they finish their college or school they are chilling, food is served on platter, plate is taken away, water is given in the hand, clothes are set, clothes are folded and kept in the cupboard. All these things cannot be. So you have to give small responsibilities from the age of 10. Clean your table, fill your own bag, put your tiffin back in place after you have come from school, put things back, put shoes back. After you have used clothes, have to go back, go to the bin where you put in clothes for wash. Plate after you have eaten have to go to the sink. Small things like serving water, setting the table, cleaning, cooking, small things. They should be able to fix a sandwich, get themselves some milk or coffee, get small chores if something needs to be done. Some amount of what we are trying to do here is train this adolescent to be able to go. So it's a training field. So you should not feel bad about giving them work. They have to understand some banking. They have to understand some finances. They need to take responsibility. Small decisions you should let them take, and let them face the responsibility. As in, if they want to stay up late and they insist that I want to stay up late, the next day if they get late in school and they miss school or they miss college or they don't do an assignment, they have to face the music. So some amount, you can't protect them at every stage. The more you protect, they will never be able to ready to take it on themselves in adulthood. So also we have to teach them to hold friends together. So these friends will last for life. For that, parents have to show in action that I am in touch with my school friend, I am in touch with my college, my graduation friends. We meet, we keep in touch, we now know each other's families. So that kind of scenario children have to see at home. So we have to teach them to hold on to. So because as they grow, it gets busier. So these friends are people whom they can call at any point in time and seek help. So these friends have to stay. So these are what, and all the time remembering that I am training him to deal with the outside world. So I need not protect him too much. I need not mollycoddle him a lot. I need not give him a very lavish life. He has to understand that he has to do some hard work. He has to slog. He has to finish his assignments himself. Even if he is staying up, you should not feel too bad about it. You, when you were younger, have done it. So now it is his time. He has to do it. I think this has to. So this brahmacharya, this is our ashram, is the home, and we have to deal with children in that fashion.
So as ma'am rightly said, that rights and duties. So rights, so if you want rights, you should know your duties and you should do your duties. There has to be a perfect balance between right and duties, because that is what is going to give you that confidence. That is what the confidence building will happen in your child. So if you are asking your child or telling your child to do anything, please don't have any kind of a guilt feeling. That is one. Then second thing is that in this age, as she said, that there is a very technical term which she has used, of course, which is displacement of anger. So as a common person, I understand that yes, when you are angry about a certain thing or a certain action which has maybe happened even outside the house, you carry that anger with you, or you carry that anger to several other situations in life. Okay, now this is something which is very nicely avoidable. So that is what she spoke about, and we should really keep a tap of this. The last thing which she said was, introducing a child to small chores in the house. So these can be very small things which need to be taught to the male child, especially doing the homework. Okay, homework, not the school homework. but it's about, taking care of his own clothes, doing his own laundry, removing clothes and, folding them and keeping them back in cupboard. So these are very, very small things. Then when it comes to kitchen, why not introduce him to all the dals and pulses? Okay, he can also start preparing a small sandwich, a tea, a coffee. So the introduction of all these small chores to the male member in the family has to happen slowly, but at the right age. So this was a very good thing she said.
Okay, next we go on to adulthood and late adulthood, where a person is married, he's supporting his family, supporting his elderly parents, having a job or a business to look after, children are growing up, supporting their education. So there are a lot of responsibilities. Everybody looks upon him to sort their issues, to extend himself, and so wife and children look up to him, parents look at him to sort out. Work wise there is a lot of pressure, and in the current scenario there is huge pressure to be able to perform, to be consistent in your performance at work. So all these areas can create a lot of anxiety, lot of pressure, lot of worry or fear of failure in that person. What are the things that can help? One, and this stays true at all stages. If you're physically fit, you are able to deal with anything. Okay, so that is 50% of the job done. So mental health and physical health go hand in hand. You cannot be mentally well when you are having physical illnesses. So maybe at this age, if it's a poor lifestyle, then if he has developed hypertension, diabetes, dyslipidemia, that is cholesterol, so then he will not be able to lead, he cannot be mentally optimal. So one is looking after yourself, and that goes for all stages. So physical fitness and so some form of exercise, say some pranayam or some meditation, some hobby that you have picked up as a child or as a young adult that helps you. So in your routine time, once in a week, twice a week, you have to find that time which is my own time, which is not my spouse's time with me. That is a separate time. But 2-3 hours in a week you have to find where I am doing what I like to do, which is unstructured. I may do a class, I may learn a musical instrument, I may go to the bookshop and read, I may meet a friend for a coffee, or I may go exercise, or I can do what I want to do, what I really like doing, what gives me happiness. I need to do that. That is so nurturing yourself, being your own parent. That is very important. Now that person is an adult, his parents are elderly, so they are not going to be able to tell him or support him or look after him. It's the reverse now. So who will look after this grown-up adult man? He himself has to look after. So eating healthy meals, getting annual health checks done, having a set of friends that he meets very regularly, having a hobby, that is very important. Maintaining a work-life balance, that is extremely important. Now with many people still working online, it is very difficult to keep that work-life balance. But what you have to understand is we are earning, or we earn, or we work to be able to earn money and get comforts with that money home or for ourselves. But we spend long hours of the day, say 12 to 16 hours in the day working, then how are we ever going to be able to enjoy? So compartmentalizing your life is very important. This is my time, this is my vacation, and you have to understand that you may feel that I am indispensable. I cannot, if I don't work, then work will suffer, bosses will be upset, how can I ask for leave? But you have to understand nobody is indispensable. if you keep working at this rate, you are going to fall ill, and if you fall ill, then the whole thing crumbles. You will suffer, your family will suffer, and your work will suffer. You also have to understand that the first people to suffer will be your family. So if you do not look after yourself, the whole family is in trouble. Another thing you have to understand is, a lot of the times there are emotional push and pull at home as well, because say if you're living in a joint family, and there could be clashes at home, there could be adjustment issues at home. You have to understand there is so much that I can do, and each one is responsible for his or her actions. So rather than getting physically involved in their fights, or trying to patch up things, or trying to take on too many responsibilities of keeping everybody happy, is not your job. Your job is to be there is only so much you can do. If they wish to continue to have their clashes, you can either tell them to go seek professional help or sort it out between themselves. So many times men do get hassled with this, and if there is job pressure as well, then they can end up having anxiety or depression, which needs to be sorted. Third very important thing, again this goes from the time of teenage till older adults, is staying away from addictions. Why it is important in teenage to keep away from smoking and alcohol? Because your brain is very young, it has not fully matured. If there is exposure to smoking and alcohol and cannabis before the age of 21, then there is high chance that that person as an adult will become an addict. So it's important to stay away from these substances, not look at them as your coping skills. So if you're anxious, not turning to alcohol and smoking. If you are depressed, or if you're feeling low, or if there are too many stresses at work, then not turning to these things as your coping. Now there is enough. COVID has taught us one more thing, and that is awareness about mental health. Everybody, there is not a single person who is not touched because of COVID and its hazards. So all of us know the importance of mental health, that however strong you are, however whatever great job you are doing, you can for a short time or a longer time have a mental health crisis, and you need to deal with it. Like you can have fever, typhoid, malaria, you can have anxiety, depression. It is very much treatable, very much can be taken care of. So you have to access help. I think if these things are looked after, adulthood can be taken care of, and it can be a smooth sail. When a person goes into older adults, that is Vanaprastha ashram in older times, now say if you look at 50 years and more, there has to be some part of giving up or letting go in your responsibilities. Your children may have grown up by now on their professional courses. So some amount of giving up, accepting their decisions, supporting their decisions is very important, and at the same time having a parallel interest for yourself. There has to be something new and exciting that is happening that will keep your interest going. So taking up a hobby, or taking up say if you're interested in some part-time work that interests you, you want to do say consultations, or but keeping it, or learning something new, learning totally something different. Many people, when they have practiced a certain branch for many years, say till 50, they feel exhausted, they feel it's the same thing, I want to change and do something else, start a business venture. But something has to start to keep going, because children now do not need your time as much as they needed when you were younger. Financially you are in a better state at this point, and you are not struggling or not trying to show your skills at work. You have done and you have proven yourself. So now you need to look after yourself, and what am I going to do? Now longevity has made us easily, everybody reaches 80, 85. So you have to plan that transition, that now I have to have time that I can spend fruitfully, meaningfully, maybe looking at a larger cause, social cause, maybe giving back to the society, taking up a social cause that you feel very strongly about. It could be education, it could be many people are interested in segregating waste. There is a very active movement about it, or education, or maybe environment, or anything that that you feel strongly about. And so rather than waiting for that change to come in your environment, you make it possible, you put in that initiative, you start something new. Unless we keep reinventing ourselves, life can be quite dull. So now when physical health has improved because of vaccinations and better infection control, we are able to lead a longer life. I think we need to keep ourselves active. Many times when in old age some people lose their spouse, or there is loneliness, and say a man is lost his spouse, or a woman has lost his spouse, women still adjust better because they are busy with their daily routine. They keep themselves busy in daily chores in the house, or maybe cooking, or having their set of friends in the evening. But men find it very difficult. So interest cannot be developed at this age unless you are actively wanting to do it. Unless you keep that structured in looking, having a foresight that 10 years from now I'm going to have plenty of time. So I have to start planning now. How you plan your retirement, how you plan children's education. In the same way, you have to plan, what am I going to do when I'm 60? What am I going to do when I'm 70? And keeping in mind how your physical health is going to be at that time. And I think if there is foresight, there is planning, there is communication, there is discussion on these topics early on, these things will help in, because we are anticipating. When you anticipate, it doesn't come as a shock, then you are prepared for it. So I think these points will really help in keeping mental health, enjoying that time. I hope this session has been helpful to, and I hope I have been able to bring forth some important topics that will help all of you. Have a good day. Thank you.
I like the word ma'am used, that mental optimal condition. When you're not physically fit, so be it a man or a woman, if you're not physically fit now, your mental ability to think, because your mind is diverted towards that physical part which is in pain. So like she said, that mentally, if you have to perform the best, or the optimum, you have to take care of your physical health, okay? Because this is what is going to help you handle those extra responsibilities which you have as a male member of the family. And also one good thing she mentioned over here is that most of the females are very talkative. Sorry, I'm generalizing, but yes, females have this tendency of making friends faster many a times. This is not a very much observed habit in males. But what she has suggested over here is that males should always have certain set of friends with whom they can chat regularly, they can express regularly, so that when as they grow old, they have somebody to vent out. So that is what she mentioned. Yes, she also mentioned about addictions in this stage of life, where you very easily get addicted to certain habits because of stress. So the first habit which generally a male member very easily gets adapted to is smoking. The next is, of course, drinking. So she has told that how you have to take care of these addictions, because these are like the shortcuts, actually to come out of this mental stress and everything. So please don't get into these shortcuts. The last thing which she said in this part was so important, that please treat anxiety, depression, mental health problems as just you treat your fever and cough. So if you get a fever, if you get a cough, you immediately rush for medicines, you immediately start your treatment. Okay, you don't hide it, or rather it is something so visible that the other family members can immediately make it out. But when you have these kind of feelings, the anxiety, the depression, feeling low kind of a thing, please speak about it. And this is also to the family members, that please don't treat this like a taboo, or please don't try to hide it from the society. This is something which is 100% curable. Okay, and as she rightly said, that the treatment, if it starts at a right age and at a right time, then everything is curable, everything is controllable. So, Prajakta ma'am, thank you very, very much. I really like the way you put things. Especially, I would like to highlight here while saying goodbye to you. One more point is that developing hobbies right from the beginning is so important, because in the old age, there is a lot of they say that a senior citizen is always like a small child. So yes, you become adamant, and then you don't want to adapt something which is new. So if you have something adapted right from the beginning, these hobbies or these interests actually helps you keeping yourself live throughout that old age, when maybe you are without your spouse, especially the man. Okay, and when you are alone in the house. Okay, and how you develop your interest, how you stay active is more important. So as she rightly said, and I'm going to summarize this, that for every man, that how you plan your child's education, how you plan the safety of your family members by taking insurance policies, how you plan the safety of the financial well-being in your absence. Similarly, you have to plan your retirement. So she put it so nicely that you have to anticipate things. Okay, because if you anticipate, you will be able to do things in a right way. So what will I do if I stay till 60, till 70, till 80? So thank you, Prajakta ma'am, for explaining this so creatively. And we wish you good luck in your career, and wishing you a very, very healthy life. Thank you so much.